Ladies and gentlemen, it's an honor to be here. Thank you very much for the invitation. My name is Dominik Olejniczak, and I'm representing the Department of Public Health of Medical University of Warsaw. And I'm going to tell you about health determinants models regarding to practical application. I would like to start with two photos. Photos of guys who are actually responsible for today's meeting. The guy on the left side is Mark Lalonde. We all know him. He served as Minister of Health and Welfare in Canada, and he is the author of the first and I suppose the most known model of health determinants. And the other guy at the right side, he's Charles Edward Amory Winslow. I could call him Lionel Messi of public health, or I don't know, Diego Maradona of public health. So we all know him. Why I've shown you these two guys. The main reason is public health definition. The science and art of preventing disease, prolonging life, and promoting health through and this is the most important thing, I think, organized efforts and informed choices of society. Of course, not only society, but also organizations, public and private communities, and individuals. But the main point, this is the both things. So organized efforts and informed choices of society. What does it mean in practice? It means that we are all responsible for our health. It is the population that is primarily responsible for health. So it's not government. So it's not prime minister, not king, not queen, but we. Health determinants. This is the very large topic, and today I will talk only about the small part of it. As we know, there are lots of health determinants models, but there is no publication that would describe all of them. However, it's important to remember that models are only a kind of framework that must be used appropriately, and the most important factor is the specificity of the population. And regarding to Mark Lalonde, this is just to remind you, he divided these factors on four main groups, and he of course gave a percentage. I will tell you about that a bit later. Biology. So these are all the aspects of health, physical, mental, developed within the human body as influenced by the genetic makeup. Another group, environmental. So these are all matters which are related to health external to the human body, over which the individual have or little of even no control. So including the physical and social environment factors. The most important thing. So this is as we know, lifestyle. So this is actually the aggregation of personal decisions, actually, over which the individual have control that can be said to contribute or use of illness of death. And the last thing here in this case, the percentage is the less, is about 10%. This is the health organization. And what does it mean in practice? And it of course includes medical practice, but also nursing practice, hospitals, medical drugs, public health services. So this is the very important from all point of view. But regarding the percentage, of course, biology and environmental factors. This is about 20%. Lifestyle as a main health determinant, it's over 50%, and as I said at the moment, healthcare organization, this is about 10%. What's important regarding to Mark Lalonde health determinant model, it has only historical value. Today, much more accurate models exist. Also, the individual countries have their own models. So the ones known worldwide are general. And as I mentioned at the beginning, this is the only kind of framework. And the next question is, why does it happen? Yeah. So the answer I want to suggest is the influence of health determinants among countries is different, even if we are talking about the same factor. And for a couple of slides, I will try to show you why it happens that way. As my example, of course, what's obvious will be Poland. Regarding to models, this is the also well-known model, Dalbr and Whitehead. I guess you know this model very well. This model is very popular, so that's why I decided to put this model to my presentation. And again, what's the most important from the point of view of impact on health? Look, factors that depend on us. Yeah, so these are health behaviors. So it's quite obvious. So if we know that the health behaviors are, this is the most important thing. So the next question is, what determines health behaviors? So the answer is not very simple, actually, and we can answer it lots of ways. It can be age, it can be occupation, it can be culture, it can be advertisement. I will give you an example. For instance, alcohol advertising in Poland is not prohibited. It should be, but it's not. I thought that maybe will be here someone from Lithuania, because I have an example from Lithuania. By 2016, Lithuania had the highest alcohol consumption in European Union per capita, and they decided to change it. How they did it? They introduced a new legislation banning alcohol advertising from all foreign and domestic TVs, radios, printed media, and the internet. So it means that it can be done. Yeah, it's not impossible. It can be done. And let's back to the question: what determines healthy behaviors? We can add here trends. And what's, I suppose, the most important thing, level of health literacy. So now I would like to pay my attention on health literacy, which involves the knowledge, motivation, and competence to access, understand, and apply health information to make informed decisions regarding healthcare disease prevention and health promotion. What does it mean in practice? So the health literacy represents the personal knowledge. So as we understand, it means health behavior also. This knowledge and competences that accumulate through daily activities, social interactions, and across generations. So the health literacy is mediated by the organizational structures and availability of resources that enable people to, as I mentioned, to access, to understand, appraise, and use information. So this is the key word, I guess, the use of information, and services, of course, in the ways that promote and maintain good health. And we should add here not only good health, but well-being. For themselves, for those around them. So it means immediate surroundings. And the last thing I mentioned, so the immediate surroundings and this well-being is very often in sources described as organizational health literacy. To describe it maybe more widely, for example, in the United States of America, the health literacy is a stronger predictor of an individual health status than, for example, income or employment status or education level and racial or ethnic group. So we see that this is the very strong predictor. Coming back to Europe, even in economically advanced countries in Europe, Many children, adolescents, and adults have limited health literacy skills, which means that we have a lot to do, having knowledge that this is the one of the most important health competencies, which means health behaviors, actually. And according to surveys in the WHO European region, population health literacy follows a social gradient and can further reinforce existing inequalities. So, so that's why I paid my attention to health literacy to make you aware, to make all aware that this is the one of the most important health determinants. And now let's back to Poland, as I promised, as an example of differences I mentioned at the beginning of my lecture. And the first example is the most simple indicator, so life expectancy. For a couple of slides, I will show you the website where you can find data like here for all the EU countries. So I believe it can be very useful for you in your work. Look, here we have average for all the countries. We have average for EU, and pay your attention on Poland. Look, this is 77 years. So regarding to average in EU, we are 3 years down, yeah, and we have Spain 83 years. So here the difference is 6 years. That's a lot. That's really a lot. I remind you that we are talking about average, yes. So this simple data, because this is very simple data, this is very simple indicator, tells us that we have to properly recognize the health determinants to make this life expectancy longer. So it's very important to, as I mentioned, to create models which are specific for all the countries here. And differences in health determinants, of course, as I mentioned, there are many factors here. So it can be a region, including climate and environmental factors, which are different even in area of countries. For instance, Poland, regarding to the climate, on north we have sea, and on south we have mountains. So the climate factors are different. Yeah, so it's an obvious thing. Level of pollution, for example, air pollution. Then size of the population. Another thing, health awareness. So this is actually the same as health literacy. Influence of commercial health determinants. Regarding to health determinants, I will pay my attention for a couple of minutes. And using of e-health, as we know, the e-health services, this is the one main direction where all the systems goes. Yeah, so there's no doubt about that. And now I would like to pay my attention on Slavs countries, which are culturally close to Poland. Why? Because it might seem that it would be similar. I'm talking about the health determinants, but it's not. So let's start from the Bulgaria. And as we see here, the figure, of course, this regarding to the source, this is the source I will use for a couple of minutes. I will show you that for all the countries. Mortality. Look, at the first place, we have the percentage here, as we see, and we can compare it regarding to the EU. It's very useful thing. So here we have dietary risk, another place tobacco, and then air pollution, alcohol, and the low physical activity or physical inactivity, as if we can call it like that. Okay. Another. Okay, Czechia. So the order is the same, percentage quite different. Look, so we have here also dietary risk. Still at the second place there is tobacco, then air pollution, alcohol, and physical inactivity. Here we have Slovakia, so another Slav country. Look at that. Dietary risk, tobacco. So again, order is the same. So, and now Poland, look, something changed regarding to Slavic countries. So in Poland, the main the main challenge is tobacco, not dietary risk, but tobacco. So it shows us that even if we have the same factor regarding to countries, it has different influence. And this is the thing I find as a very important and one of the points of our today's meeting. Okay. Here I have to say huge sorry because I didn't translate this, but I will try to do it now. So here we see causes of death, and I compared 1990 with 2023. And what's the point of this slide? I just wanted to show you how the health problems changes in time. So first two positions, these are cardiovascular diseases. These are causes of death. Yeah. So these are cardiovascular diseases, and here at the number 2 we have cancers. Yes. So here there is no changes, but on the other numbers here 3 in 90s. On the third place was chronic respiratory infections. After 30 years, it's not anymore third place, but 8th. So there is a change. Here, as we see, the main problem is respiratory infections, but including tuberculosis. Look, in 90s, it was 9th position. Now, it's 3 years ago, but still, it's 3rd position. So we see that this is quite dynamic situation. What's important? Here we have problems and diseases of digestive system. Here it was 4th place. Now 2023, it's 5th place. We have neurological diseases. This is the 7th place. So in 90s, it wasn't a huge problem. Now we see the change is already 4th place. Yeah. So as we see, these factors change, and this is the one of the main challenges for public health to react on these changes, to make health system ready for these changes. So that's why I decided to show you that. Here, one more thing, the healthcare system should be adapted to the needs. Yeah. And here we see the figure regarding to cancer, but there is a very simple indicator like sex. Yeah. So we can divide the population. So this is the most simple factor. We can divide population, so men, women, and here we see structure of cancers, which are main problems in Poland. So this is important thing, and we of course have the same data for all the countries in EU. What's obvious regarding to men, we have prostate cancer. Women usually do not suffer from prostate cancer, as we know. So it's obvious thing. But here we can also use this data to, as I said, adapt the healthcare system to the needs regarding to population. In this case, men and women. Of course, these factors we can discuss regarding to age, for example, place of living, occupation, and so on. But the sex, this is the most common factor we can divide population. Okay. And now let's back to influence of factors I mentioned. So also for each country, there is a kind of dashboard, yeah, and we can see here the influence of these risk factors, which are, as we see in the title, which are prevalent in Poland, that is mostly EU countries. So maybe for now, it's not the most important thing, but at the next in the next slide, I will show you the databases I mentioned about, and I think this is the most practical part of all today's meeting. So now I just want to make sure if okay, if you still see my screen. Do you see the website? Okay, right. So let's start from the interactive dashboards. Okay, just to try to move it. Right. So for each country, as you see, we can choose country you want, for example, here. We can see fantastic dashboards, which includes...
We see figure 7. Is this?
What's more?
We see your figure 7. Is this what you are showing or something else?
You should see a website with dashboard.
No, we don't see that.
Yeah, okay. Okay, so I will try to change something. This is very
you need to leave the presentation and enter a different window when you share to share again.
Okay, I will do this. Okay, it should be okay now. Is it? Okay. So let's back to all dashboards. And of course, I'm not going to show you all these dashboards. We haven't got enough time for that. But for instance, here we have Belgium, and we can find the data regarding, for example, daily tobacco smoking rate, and we can compare it with EU. Another thing, obesity. This is as you recognize for sure. This is the dashboard I've shown you for Poland. So for each of these countries, the dashboard is available. Let's see for Cyprus. For sure, you've seen the change. Look, tobacco, Cyprus, they are above the average here. Belgium was low, Cyprus is high. Obesity, like the same. Alcohol, not bad. And the last thing, not to waste your time, maybe Sweden, if you want. See, for sure here will be fantastic. Look. Wow, the problem with obesity. You are over the average. Yeah. Okay. So just to show you another another sources. So look, we have here even doctors and nurses per 100. Yes. So these are indicators which are not strictly dealing with health, but still have an influence. And here, look, we have expenditure. So this is the really fantastic source. And another thing, I just want to make sure if you see the website of European Commission now. I suppose yes. And look, here we have something which is called country health profiles. And here for all these countries, we can, let's take, okay, maybe my way this time. We have kind of report, also with fantastic dashboards, and I just want to show you, I think you know, right here. So, as I mentioned, for each country, the source and the figure like that is very useful. It's really very useful. Okay, so we can see here still dietary, but look, Norway has 13% regarding to mortality. European Union average is 17%, so this is quite a good indicator. The same thing in tobacco. Here we have 12, average is 17%. Let's check, for example, okay, let's say Malta. Still dietary risk, tobacco, and here, look, in Slav countries, as when I was showing you that, the low physical activity or physical inactivity was at the last place. Here in Malta, look, this is the third place. So there is a change. So the risk factor is the same, but the order regarding to country, this time country of Malta, is different. So the conclusion is that Malta has something to do regarding to low physical inactivity. And of course, they have to be aware of consequences of low physical activity, like cardiovascular diseases, like obesity, like hypertension, so on, so on. Okay, so now let's back to my PowerPoint presentation. So again, I will ask you if you see my presentation. So this is the challenge for me, as you already know.
You need to make the same operation back again. We see your website now.
Right. Okay. Okay, should be okay now. Okay, so I hope you see the figure. Okay, these are this is the link. These are the two links to the websites I'll show you at the moment. So this is the fantastic data source, and as we know, not only in health promotion but in all public health, data is the basic thing to plan health policy, to measure burden of risk factors, and so on, so on. So that's why I find this as a very important thing. Okay, so now let's go to the commercial health determinants I mentioned about. So first, briefly. Commercial determinants of health are the private sector activities that affects people's health directly or indirectly, positively or negatively. So, what does it mean? What does it mean in practice? So, the private sector, of course, influences the social and physical and cultural environments through the business actions and societal engagements. So, for example, supply chains, labor conditions, product design, and packaging, research, funding, lobbying. So this is the very important thing. And preference shaping and others. And the thing I want to tell you is that commercial determinants of health affect everyone, but the young people, that's why it's bold, are especially at risk. So it tells us that we should pay all attention as a public health specialists, as a doctors, nurses, and people who shaping the healthcare systems. We should pay attention on young people because they are especially at risk, as we see here. So I guess this is the one of my main conclusions, but for the last slide, I've prepared 3 more conclusions for today. So the first one is that the model of health determinants must be fitted to the population, not the population to the model. So this is the very important thing. That's why I mentioned about that the health determinant models we know. This is the only kind of framework. The other conclusion, so the proper definition of health determinants, it's the crucial when choosing health policy priorities. Of course, we all know that this is the process and long-term process. So nothing can be done immediately. And for the end, the team determining health conditions and directions of actions must be interdisciplinary. So as public health is interdisciplinary, so regarding the shaping healthcare system, the same condition has to be done. So thank you very much for your attention, and that's all for now. Thank you very much once more.